I'm pleased to be here with Ron Williams, who's the chairman of RW2 and the retired and former chairman and CEO of Aetna. Ron, great to be with you.
Well, it's a pleasure to be here this morning.
So tell me what your take is. Now we're 2 weeks, roughly give or take, into the launch of the ACA exchanges. What are you seeing?
Well, I think there is enormous noise, and I think clearly ACA has been poorly implemented in terms of the exchanges. I think in the long term, the implementation will be noise. I think this will all settle down, it'll all clear up, and we'll get down to the fundamentals of, do we have the right products, do we have the right subsidies, and can we incent a balanced risk pool of people who need health insurance because they have a current health condition, and young healthy people into the program so the program is fiscally sustainable.
One of the things that everyone's talking about is whether or not young people will enroll in these exchanges. How optimistic or pessimistic are you about that?
You know, I would have to say I'm probably somewhat pessimistic. I think that young people tend to believe they are immortal and invincible at that stage of life. And I think it's going to take a while to create the kind of societal norm and perhaps even a few stoplights here and there that says, gee, if you want a student loan or you want to apply for this, you want to do that, you have to demonstrate that you actually have insurance. That's a debate we haven't had as to whether we think that's an appropriate approach to move a little bit from the carrot to maybe a little bit of a frozen carrot.
So maybe strengthen the individual mandate effectively by adding some other tweaks to it to incentivize people to buy the insurance.
Yes, I think that's something that ultimately we'll probably have to take a look at. I'm sure that the people who need insurance and for whom this is a very important solution will in fact sign up.
Do you think the mandate is too weak right now in terms of the fines or the penalties that are associated with it?
Yes, I think it really does not represent much of an incentive or disincentive for people to sign up. I think those the whole area of mandate will be an area of looking at the penalties for it and the incentives for it. I think that'll happen 2016, 2017.
You stood out in the debates of 2009 as being a CEO of an insurance company that was really pro-reform, really in favor of expanding coverage. Do you think that the ACA has played out in the way that you expected in that regard, and how do you see it playing out in the future?
You know, I really was very deeply committed to the notion that we have a moral obligation to make certain that everyone has access to health care services. I have to say that I found the process of the legislation extremely challenging. I think that it would have been better if we could have done it in a bipartisan way. I'm not the right person to say whether we could or couldn't, but I think it would have been better. I think we wouldn't have nearly the acrimony that we have around the issue today. I think it is law, it's the law of the land, the regulations have been imposed. I think we now have to get down to figuring out how do we make it work, what doesn't work, and what do we need to change in order to make certain that we are fulfilling the real issue, which is how do we as a rich, wealthy country provide access to health care for our citizens.
If you were in charge, which you're not, probably to your pleasure, what do you think, what would you want to change about the ACA?
I think the first thing I would change is I would make the subsidy available to individuals whether they were in the exchange or out of the exchange. I don't think the exchange is really works when it's a coercive mechanism that you can only get the benefits that you're entitled to by virtue of your economic status, by virtue of being in only one program.
Yeah, because the argument there, of course, is that if people have the ability to use that subsidy to buy insurance outside the exchange, then you don't have the ability to do some of the things around catering to the sick people, people with pre-existing conditions that you do within the exchange in one pool.
Well, I think that the requirements around guaranteed issue were effectively implemented in Massachusetts long before there was a health exchange created in Massachusetts. Some of the rating changes that have been made that narrowed the rating bands, which in essence makes insurance more expensive for young people so that it can be less expensive for older people, were also implemented in several states. So I don't think those things are really tied together. And I think that making the subsidies available, but maintaining the same framework so that people are treated consistently is really something that's quite doable. That's why we had insurance commissioners in 50 states before we had the ACA.
One of the things we talked about in our session today is this new trend that we're seeing of large employers moving to private exchanges to give people a defined contribution to shop for coverage that the employer would sponsor. What's your take on that? Accenture put out a report recently that suggested that the private exchanges could be even larger than the public ACA exchanges.
Well, I think they have the potential to be a significant new trend in employer-sponsored insurance. I think it moves the employer out of the administrative business of holding open enrollment, being responsible for all the administrative processes, and it also gives the employee broader choice and often an opportunity to purchase supplemental benefits that fit their own tailored circumstances that the employer may not have chosen to offer. So I think, again, it'll be a new trend. It'll take 2 or 3 years for it to begin to take hold and mature, and for us to have some actual experience, both financial as well as from the consumer satisfaction.
What's your take on whether employers will continue to offer coverage or offload that onto the public exchanges?
You know, I think that CEOs of companies I talk to recognize that their most valuable asset is their employee population. And they will not lightly make that decision. And I think a lot of it will have to do with the nature of the networks on the exchanges. Some of the networks that I've seen are broad and represent the same types of networks you'd see in your commercial products sold to employers today. Others are Medicaid-like, very narrow, channeling to certain institutions, and they don't represent the breadth of choice that employees would really feel comfortable with unless they didn't have any other options. So I think we're going to have to see. My sense is employers are going to watch and wait. They'll get some experience with the private exchanges, but the whole question of whether they would abandon coverage, I think, is not yet clear. One of the reasons simply is that today the penalty for abandoning coverage, it still represents a potential savings. My own opinion is if employers begin to abandon coverage, the penalty for abandoning coverage will be much greater than the savings available to an employer.
Makes sense. One of the other big changes that the Affordable Care Act makes is it reduces the amount that insurers are paid to offer Medicare Advantage plans. But what's been surprising is that while the Centers for Medicare and Medicaid Services predicted that as a result, a lot of people will exit Medicare Advantage and go into traditional single-payer Medicare, that hasn't happened so far. Enrollment in Medicare Advantage continues to grow. Why do you think that is, and how do you think insurers will fare in this new Medicare Advantage world?
Well, I think Medicare Advantage is a very attractive product for the consumer because it gives them a single set of integrated benefits and a single set of administrative services and contact. I think one of the ways the health plans have managed it is that Medicare itself is a very unstructured program, and a beneficiary can literally wander the healthcare system seeing a wide variety of physicians, have their care uncoordinated, excess medication. And so the plans have found a way to coordinate that care, make certain that the beneficiary is getting what they need, and often able to provide supplemental benefits as a result of that. As the premium comes down, premium contribution from the government, the big question is, are the health plans permitted to offset that decrease by charging a premium to the consumer? If the consumer sees value, they would pay the premium. If they didn't, they would return to regular Medicare.
And you sit on the board of Johnson & Johnson. From that vantage point, how is Johnson & Johnson seeing the health reform world and the healthcare landscape around the world?
Well, I think I would leave it to the management of Johnson & Johnson to speak for the company. I would say generally one of the things we all worry about is the impact of it on innovation. The U.S. has been the pharmaceutical and medical device innovation engine for the world. And I think what we have to be certain is that as we look at all the changes in the system, all the new taxes, all the new regulations, all the new approaches, that we don't in fact end up inhibiting innovation, which has been such an important contributor to the health status of the population and to economic growth.
One of the things that's been interesting in the last several years in the United States has been a dramatic rise in the penetration of generic drugs. So I think it's 80% now, maybe even higher than 80% of all prescription volume in the United States is generic drugs. How much does that affect innovation in the sense that the competitive challenge of developing a drug, you're spending all that money, hundreds of millions of dollars, and then at the end of the day you're competing against cheap generic drugs that are pretty effective and pretty safe?
I think it's a recognition that companies have to have that everything has a life cycle. And therefore, it really causes companies to just think about everything in the context of that life cycle, and that ultimately things will go generic. That is in fact good for the consumer, because the consumer can get more value for their dollars. And also, I think in general the industry seems to be looking at how it conducts research and develops new formulations in different ways.
Well, I know that you're a big connoisseur of jazz, and the Affordable Care Act can be seen as kind of a lot of disparate elements that are hopefully going to produce beautiful music. So we'll see if that's how it plays out or some other way. Thank you so much, Ron, for joining us today.
My pleasure. Thank you for the opportunity.